Every person should see a pelvic therapist in the postpartum period. So the first question that often comes up is, when in the postpartum period should you schedule an appointment with a pelvic therapist? And the answer is, most people in the postpartum period will visit their OB provider approximately 6 weeks after their birth. At this point, the OB provider is assuring that you are healing correctly, healing well, and this is often when, if everything is going as expected, that they'll give you the okay to engage in sexual activity. It's at this point that it is completely safe to visit a pelvic therapist. So the reason you should visit a pelvic therapist is your body has gone through an enormous number of changes. A pelvic therapist can help identify any of these changes that may need to be addressed with manual therapy or exercise prescription. For example, we can help identify a diastasis rectus abdominis. This is when the abdominal muscles separate as the belly gets larger during pregnancy. Now, this happens with many women, almost most women, and most women it will heal on its own over the next year. However, if a pelvic therapist can identify this diastasis, we can give you exercises to facilitate that healing and also to guide you on what exercises to be cautious with when you return to an exercise routine. And if the diastasis is larger than what is considered typical, we can provide or suggest supportive garments to help facilitate closure of that diastasis rectus. We can also help to guide you in returning to an exercise routine. Again, your body has gone through an enormous number of changes, and returning to an exercise routine is a little different in the postpartum period than prior to your pregnancy. So we can help guide on which exercises to do, signs to look for, when you should be cautious with exercises or maybe not proceed as aggressively. Some people in the postpartum period will experience urinary symptoms such as urinary incontinence or constipation or bowel incontinence. Some will develop pain with sexual activity. A pelvic therapist can assess a person in the postpartum period to figure out why the person is experiencing such symptoms, and we can utilize manual therapy techniques, exercise prescription, and education to help reduce or fully resolve those symptoms. So regardless if the person has symptoms or is completely asymptomatic in the postpartum period, it's always a good idea to have one appointment with a pelvic therapist just to make sure you're back on track and that you're returning to a safe and healthy exercise routine.